Good morning, everyone. Welcome to our workshop. My name is Ella Hyman, and I'm a sophomore here at WashU, and I use she, her pronouns, and then I'm also an intern for the Midwest Climate Collaborative. I just have a few housekeeping notes before we get started. So this is workshop number 23, Policy and Practice Strategies to Mitigate Health Impacts of Climate Change. This is a 1-hour workshop, so we will conclude at 10 a.m. If you are looking for a different workshop, now is your time to relocate. Before we began, I wanted to walk through a few items both for people in this room as well as for people that are joining virtually. If you are going to be asking questions, obviously if we are in person, we will have a mic that will be wandering around the room. And then if you are joining us online, please keep your microphone off as we will be doing all questions through our app. And so if you look to the left-hand side of the screen on the app, you will see several tabs. These include a question and answers tab, which is a chance to submit questions to the presenters. You will see polls, which I don't believe will be used in this session, so no need to worry about that. You will see a chat, which is an open chat room tied to the Zoom chat where you can interact with the presenters and follow attendees, and I will be monitoring this chat on the app as well. And then also a community tab, which allows you to interact with the full audience of attendees at the summit. Please make sure that you are entering a question or remark in the proper area because I will be monitoring only those 4 areas during this session. So let me now introduce today's presenters. April Shaw is a senior staff attorney at Public Health with the University of Nebraska Medical Center. No, sorry, it's a little small on my side, I apologize. April Shaw is a senior staff attorney with the Network for Public Health. Sorry, it's a little, I apologize, it's very together on my end.
You're good. Do you want me to do it?
Public Health Law. No, I'm good. Sorry. Thank you. I apologize. And then Rachel Lukadu is an assistant professor at the University of Nebraska Medical Center. I apologize for the confusion there. This presentation is going to be really exciting. We are looking forward to it. There will be 2 20-minute presentations, and then the last 20 minutes, more or less, will be time for a question and answers session. Thank you, and we hope you enjoy.
Thanks, Ella.
Can you guys hear me okay? Ooh.
That's weird. All right, so I'm Rachel Lukadu. As Ella mentioned, I'm from the University of Nebraska Medical Center. I'm faculty within our College of Public Health, and I'm also the Director of Public Health Policy for our Water, Climate, and Health program. And so while I am a JV as well, I am not going to be touching the policy side of things. I am doing all the practice strategies part. Okay, so I'm going to be focusing specifically on drought and health. So talking a little bit about the health impacts of drought, as well as a project that we've been working on the last few years, looking at how we can engage public health and other stakeholders to better prepare them for the health impacts of drought. So to set the stage, let's start by talking about health impacts. So this is a quote that my colleague, Dr. Jesse Bell, uses in all of his drought and health presentations, and I've decided to steal it. And it says, floods kill people, but droughts destroy civilizations. So it's a little bit dire, but I think it's accurate. Drought is the kind of disaster that impacts people's livelihoods, their ability to provide for their families, a community's ability to have food. So it's a really serious type of long-lasting disaster. So this is also the kind of disaster that causes a lot of deaths. Sorry about the Zoom bar there at the top. What was that you call this?
Control Shift H8.
All right. So this is the percentage of disaster deaths worldwide between 1900 to 2013. According to type of climate-related hazard. You can see when you look at this, drought has by far caused the highest percentage of deaths, more than all the others combined. And I think it's important to note this because we often think of hurricanes or floods or these other types of more acute disasters as being the deadlier types of disasters. But really, drought is causing the most deaths. And I promise it's not all doom and gloom. I try and get all that out the way at the beginning. So apart from deaths, it can be really hard to track the health impacts of drought. Drought is a slow-moving, slow-evolving disaster, and the health impacts are not always immediate. They can take a while to show up, and they often require some type of intervening factor before we actually see those outcomes. On top of that, the data surveillance and data collection systems we have really aren't designed to track the health outcomes of drought. So, for example, we know with drought there are more extreme heat days or more wildfires, etc. But if someone goes into the ER with respiratory issues because of that sort of circumstance, they're not getting an ICD-10 diagnostic code that says drought or climate change. So it's kind of hard to track those impacts. But nevertheless, we persist. So this is a graphic that some of my colleagues at UNMC made that I really like for explaining health impacts of drought. So you can see here, this shows the immediate definitional impacts of drought. We know when we have a drought, we've got higher temperatures, lower precipitation, lower snowpack, less runoff, less groundwater. That always happens with every drought. And that leads to these secondary impacts. So with drought, we see more dust storms, more wildfires, less water quality or water quantity, more heat waves, impacts to food security and agriculture. And we also see changes in vector habitats. So things like ticks and mosquitoes often have more places to breed and live when there's more standing water and less water moving. So all of those things in that yellow circle then lead to our health impacts. So with that, we see respiratory issues like allergies and asthma, those things increase. We see more injuries, more GI illnesses, definitely more heat illnesses. As a result of those vector habitat changes, we see more infectious diseases. So things like West Nile virus or valley fever, more of that happens when there's a drought. Obviously, we see more hunger and famine as well. And then one of the ones that's really important to me and that I think we need to study more is the mental health consequences. When a drought happens, particularly in a rural agricultural setting, that can be really hard for farmers and ag producers. They're losing their ability to do their business, to provide for their family and their communities. And they're often in areas where mental health treatment is stigmatized. And so that's an area that's really important. I'll get off my soapbox, but that's something we probably need to explore further. So this slide covers kind of the same information as the last one, but in a little more linear fashion. So we see here we've got drought, that leads to these exposure pathways or intervening factors, and then that is what leads to health outcomes. But what I like about this graphic is it focuses on two other contexts that are incredibly important. So you see at the top, we've got our environmental and institutional context, and then at the bottom, we have social and behavioral context. So with environmental and institutional, that's really looking at what's the built environment in an area where we're having drought. What's the readiness and preparedness of public health departments and healthcare entities where a drought is occurring. Those things have real impacts on how drought is felt in a community. And then at the bottom, we have the social and behavioral context. I think we probably all know social determinants of health have a huge impact on how people experience a disaster or drought. And we know that folks who fall into these CDC-determined social vulnerability categories often face more disparate impacts of a disaster, and drought is no exception to that. So all of these things are the things we wanted to keep in mind when we started doing this drought and health work. We realized it's a comprehensive issue, and it needs to have a lot of different people involved. So the first thing we did in this is we wanted to make sure in our work that we were engaging some key stakeholders who maybe had not previously been engaged in drought and health work. So looking beyond climate science to some of those groups who may not often be at the table. We decided to focus on three particular groups: public health preparedness, emergency management, and healthcare preparedness. These are groups you don't necessarily think of when you think about climate issues or climate change, so they were people we wanted to make sure were included. So to do that, we started a project roughly probably actually 4 years ago now, with NIDIS, which is the National Integrated Drought Information System. They're an offshoot of NOAA, which is the National Oceanic and Atmospheric Administration. And we started this project to better understand and enhance preparedness and planning for drought and health. So we had a few goals, they're pretty straightforward. We wanted to understand what current research is out there about drought and health, what needs to be done, what are the gaps or issues or obstacles to keep public health or other entities from engaging in this work. How could we develop a drought and health community of practice? We think there's a huge need for that because there are so many diverse stakeholders involved. And then our main goal is actually to develop this NIDIS drought and health strategy to build on all these outcomes and to provide funding opportunities for more of this work to continue. So our approach to this project was multi-tiered. We began with a national drought and health summit. We then conducted a series of regional drought and health workshops, and then did a number of individual interviews and surveys with state health departments across the US. So I'll go through each of those, starting with the National Summit. We did this back in June 2019, which honestly feels like a lifetime ago in pandemic years, but really was not that long ago. And that was in Atlanta. And you can see from our list of summit planning partners, it was a really federal meeting. So we were looking at what's the federal landscape, what are federal agencies currently doing on this topic. We had over 50 attendees at that meeting, and we had about 3 days of presentations and really focused discussions. We covered a lot of different topics, focused primarily on the tangible logistics issues in dealing with drought and health. So looking at water quality, air quality, diseases, but also looking at engaging different groups. So vulnerable populations, state, local, and tribal health departments, and also international partners. So at the end of that summit, we had a facilitated discussion about next steps. And it was interesting to see that all of the answers that we received in that discussion fell into one of these categories. And I think if you look at this list of categories, you can see they're all focused on that idea of connection and collaboration. So you can see a lot of those words we've got. Collaboration, coordination, synergies. You know, this was all about building relationships and networks that relate to drought and health, which really helped us focus more on that idea of building a community of practice. So to pursue that further, we started doing these regional workshops. We wanted to do this to bring together people on the topic, but also because we know drought looks really different in different parts of the US, and we wanted to understand some of those specificities. So we conducted 5 different regional workshops. Our first one was in upper Midwest Minnesota, then to the Southwest of Arizona. You can see from the dates of the Arizona one, COVID was happening like as we spoke while we were there. So we had a little bit of a break in workshops. We did a virtual workshop for the Carolinas region, and then went to the upper Missouri River Basin region for Montana, and ended in the Pacific Northwest in Oregon. And this was very interesting because these are very different parts of the country. They represent different geographies, different populations, different political viewpoints. And so we got to see some really different perspectives. It was interesting when we started in Minnesota, I think we were a largely Midwest crowd. You remember in 2019 is when we had all the big flooding. So we came in fall of 2019 in a heavily flooded area, and we're like, let's talk about drought. And so that was kind of a paradigm shift for the people there. Whereas we went to Arizona, and they've been in drought for 3 decades. So they do drought every day. That's their bread and butter. So it's a lot of different experiences of drought, which is interesting to see. I wanted to share how we developed these workshops, because I think this is a model that would work really well for any stakeholder engagement in any climate work. So the first step that we had in developing these workshops was always identifying a local partner who could be a champion for us and for this workshop. So someone who could advocate for the work that we were doing. That person was often from the state health department, but not always. There were some surprising people involved. For our Portland workshop, our local partner was actually from the Federal Reserve Bank, which no one saw that one coming. But those local partners helped us in that they helped us identify people to be involved in our planning and advisory committee. That planning advisory committee was often a mix of state government, local government, academic researchers, tribal representatives, some nonprofits, just a lot of different people who are engaged in drought and health. So as we developed the workshop, we would have monthly and then biweekly calls with that group, and they helped us identify who our speakers and what our topics should be. It was really important to us that when we were going into these regions, that it was tailored to the specific need of that area. No one wants a bunch of randoms from Nebraska coming in and telling them what drought looks like for their area. So it was really important to have local buy-in by having people who were unique to the area and understood the issues there. One of the other things they did was they approved our agenda for us. And it was really, really important as we approved or as we developed our agenda that we focused on diversity. We wanted a lot of different perspectives represented in who was speaking, but also having a lot of practitioners. I don't know who all here is an academic, so I don't want to offend academics, but I will say myself as an academic, we get stuck in this weird academia bubble and we forget what the real world is like. And so it was really important to have people who were doing operational work on the ground in the field who could present on this. So even though each workshop was a little bit different across each region because of the needs of the given area, we had the same basic agenda for each one. So we would start each workshop with an introduction to drought and health, basically a much more extended version of the first 3 slides I showed you. And then we would have one of my favorite sessions, a Drought 101. So we would have the state climatologist from whatever state we were in come in and just give kind of a level setting presentation on what is drought. If you work in climate science or if you work in geosciences, you may understand drought. But if you're in public health or healthcare and someone starts coming to you with drought indices, that means absolutely nothing. So it's good to have someone come in and just explain the very basics of what drought is and what it looks like for that region. We then had a blend of panel, plenary presentations covering a lot of different topics, air quality, water quality, mental health, you name it. And then every single workshop concluded with the same facilitated discussion, where we would say, after this workshop, someone should do blank. And this was a consensus building workshop. So if you've done one of those before, it's where everyone gets to write down ideas. So that means our introverts, our extroverts, everyone's voice is visible, which was really important to us. But it was interesting to see that a lot of the same results came up at each workshop. So again, a lot about building a community, some policy ideas, and actually creating better drought plans. I think one of the highlights of these workshops was they gave people a space to connect and meet each other. At one of our first meetings, I remember we had a state climatologist speak up and say he was working on a drought response plan. And at the same time, someone from the state health department spoke up and said, well, so am I, but they'd never met and they'd never connected or worked together. So they had the opportunity to then meet and align their efforts, which is really exciting. And we saw different iterations of that in every workshop we did. So apart from that, we also did a series of interviews and created a strategy document. So I did these interviews. I conducted 16 interviews with state health departments across the U.S. We selected these health departments based on their involvement with the CDC BRACE grants, which if you're not familiar is Building Resilience Against Climate Events or Climate Effects, Climate Resiliency, and the CDC Environmental Public Health Tracking Service. So we reached out to those states. We had 16 who wanted to participate. We asked them a set of 6 to 7 standardized questions about what drought impacts were they seeing in their area, what activities were they currently doing, and if they weren't doing anything, why not? What were the obstacles they were facing? And it was fascinating to me because I talked to states that were coastal, inland, progressive, conservative, you name it, a really wide range of states, and they all mentioned some of the same things. So every single state I spoke to mentioned private wells as their primary concern, which if you don't know, private wells are very heavily used across the U.S., and they are almost entirely unregulated and untested. So they are a little bit of the Wild West of water quality and water quantity. So that was a concern for everyone. And then the others were data availability and accessibility. If you are a researcher and you've ever tried to access health data, you know what a nightmare that can be. And also, like I mentioned earlier, there's just not the data surveillance systems that we need for this type of work. And then finally, one that kind of came out of left field and surprised me, a lot of health departments were concerned about recreational water use, whether that water would be available or whether it would be in some way tainted or have harmful algal blooms, et cetera, that could cause problems for people in the state. So all of that work is kind of coalescing into this NIDIS drought and health strategy document. This is going to be released later this year. We're very excited about it. It's based on all of the findings of our work. And this is going to be used to help inform what NIDIS does going forward, but even better, it's going to help create new funding opportunities for health departments and other entities who want to do work related to drought and health. It's also going to be used to support some policy actions so that we can kind of make the case for why we need better preparedness and planning for drought and health. So with that, I think I'm at my time, and so I will hand it over to April. April, can you see your stuff okay?
Yeah, I can, but thank you so much. You can go ahead and advance it to the next slide. Great, thank you. So thank you, Rachel, for that presentation. That was really fascinating and interesting, and I'm really looking forward to that report coming out. Today I'm going to be talking about community-based law and policy strategies to address extreme heat. Next slide, please. So I want to turn to the topic of how to use law and policy to promote health equity. At the Network's Northern Region office, we created a resource, a law and policy pathways, outlining different pathways for health departments and others to work with and support communities who are increasingly confronted with the health threats caused by heat and extreme heat, which is in the US is the #1 cause of weather-related deaths. I'm going to use the pathways as a focal point for talking about law and policy strategies to engage communities. We know that not all communities experience heat the same way. There are state-by-state differences. Some states have long dealt with heat, like Arizona, versus states like Minnesota, where my colleagues reside. Despite these geographic differences, there are key similarities across regions. For example, climate-caused increases in heat means that states must design new strategies to mitigate the harms of heat exposure. For instance, 2021 was the deadliest year for heat-associated deaths in Maricopa County, which is the largest county in Arizona, and it looks like 2022 is on track to top that. So no matter where you live, states are finding that they have to deal with heat in new ways. Another similarity is that within states, we find differences in counties, cities, and neighborhoods when it comes to heat exposure, vulnerability, death rates that are shaped by factors like race and class. So there are ultimately a lot more similarities than differences when it comes to equity and unjust social structures such as structural racism, and when it comes to barriers and opportunities for community engagement, regardless of where people live. Law and policy play an essential role in either supporting or thwarting community-centered solutions to reducing the negative impacts of heat. There's a long history of communities being shut out of decision-making processes that deeply impact their health and well-being. Next slide, please. So I want to discuss some of these barriers. This is not meant to be an exhaustive list, but they're common barriers that we've encountered. So for example, solutions often originate outside of the community or a community and then are presented to community members as an end product. When there is public participation, it isn't intentional, meaningful, or engaged, so not really designed to result in any change, reflecting the voices heard. Processes are also so often inaccessible language-wise, or at times that people can't make meetings, or at places that people can't get to. Another barrier is that agencies haven't done the work to build trust, and they have a history of exclusion and/or a history of solutions that harm communities. There's also a failure to be intersectional and cross-collaborative. We know that climate change is something that affects so many different aspects of social institution in our lives, and so it's essential that people collaborate. And there's need for fair and transparent processes for resolving competing goals or values. For example, which projects to pick, what to prioritize, and what is the role of community? Are you seeking consultation? Are you seeking a partnership? Who gets to speak for the community? What happens when there's competing community priorities? And what happens when there's competing priorities between a community and organization? So I can't see the chat, but if you want to, you can go ahead and put in the chat whether there's anything missing from this list that you think should be there, or is there an example here that really resonates with you in your experience? Next slide, please. So how can law and policy help with these issues? Law and policy, this is the Law and Policy Pathways resource that I was mentioning that will be coming out shortly. So law and policy can help by addressing the public health threats of extreme heat and centering equity, ensuring that processes and solutions center community needs and perspectives, leading with community and not treating community as an afterthought. In this pathways, we focused on 5 key categories: creating accessible cooling centers, supporting green infrastructure, engaging in community planning, protecting workers, and enacting equitable energy strategies. And we have community-centered law and policy solutions under each. And I'll just cover a few of them briefly here, and then I'll go into 3 in more depth. So for example, under creating accessible cooling centers, you can use law and policy to work with communities to remove transportation barriers, such as enacting fareless transportation so that people can get to cooling centers that are accessible by bus or rail for free. Or if the cooling centers aren't accessible by public transportation, you can provide free transportation. People can't use cooling centers if they can't get there. Under supporting green infrastructure, we recommend increasing tree coverage in formerly redlined communities whose residents experience disproportionate heat exposure. Engaging in community planning, you can add climate and community engagement goals to your declarations of racism as a public health crisis if you live somewhere where those declarations have been issued, to make sure that climate work is built into your racial health equity work. Protecting workers is also of critical importance. You can mandate that workers receive written and oral, culturally inclusive information about heat safety. But that information is of little use if workers can't take care of themselves. So how can law and policy further support them? States can pass laws that specifically protect workers from heat. Currently, only 5 states do so, despite the high level of vulnerability that outdoor and some indoor workers have to heat exposure. Workers also need health care and paid sick time so that they can miss work when it's unsafe to work and get treatment when they need it. Enacting equitable energy strategies. New York passed the Climate Act focused on clean energy, requiring that 40 to 35% of spending on clean energy and energy efficiency programs, projects, or investments, including in the areas of housing, workforce development, pollution reduction, benefit disadvantaged communities. These are just a few examples of how law and policy can be used to promote health equity. Many of these strategies go hand in hand, and I'll discuss a few more in detail. Next slide, please. So in doing this work, structural racism has to be at the forefront of strategies to mitigate the impacts of extreme heat. For example, formerly redlined communities are hotter. Redlining was a practice in the 30s and 40s where neighborhoods were identified as undesirable for mortgage lending and insurance based on race and other factors, leading to a lack of home ownership and disinvestment. Impacts today include high concentrations of impervious surfaces like pavement and few trees or green spaces, and housing that lacks adequate weatherization and AC. Even aside from redlining, communities of color and communities with high poverty rates experience some of the greatest heat and extreme heat impacts. But for many communities, the threat of climate gentrification is as big of a threat as heat itself. For example, Miami-Dade County's chief heat officer often cites a survey finding that extreme heat and displacement were both top community concerns. Climate gentrification can occur when, as relevant here, areas where new green infrastructure and other capital improvements are made, such as providing more shade and improving housing conditions through weatherization, driving up property and neighborhood values, leading to displacement. There are strategies to help avoid climate gentrification and displacement while engaging in climate mitigation strategies. In the interest of time, I'll just be brief. The first strategy is of critical importance, which is find out what the community actually wants. For example, the heat czar in Arizona has shared that residents have expressed concern over the city's plan to plant trees associated with watering maintenance and dead tree removal and the costs that those activities would incur. Many people cannot afford an unexpected bill, so a rise in costs, even a small one, is not an insignificant matter. So the agency needs to ask, is there anything you can do about it to alleviate those concerns? You also need to have a framework in place that allows you to adapt your strategies in light of community input. Maybe air conditioners and affordable bills are the priorities and trees come later. There are also other legal tools like community benefits agreements and tenant protections that can help. So you might not have thought that something as simple as planting trees would be so complex and in some cases controversial, but I think it aptly demonstrates why policy strategies have to lead with community, and as well as thinking about the role of structural racism and the harms that can be created when this doesn't occur. So if you want to, you can also share in the chat if you're working on extreme heat or another climate activity. Are you within your organization having conversations about climate gentrification? Next slide, please. Another one of our recommendations in the law and policy pathways is to adopt a cultural safety model in emergency planning. Cultural safety requires agencies to turn the cultural lens inwards rather than seeing only non-white, non-Western communities as having a culture, to overcome their own cultural biases and examine power imbalances between communities being served and the organization, and to also recognize that the individuals being served must have the power to determine when cultural safety is achieved. Cultural safety is of critical importance during climate-related emergencies. So to apply cultural safety in communications, just to give you a practical example, there are a few key questions that you can ask if, for example, you're trying to get people to cooling centers. The first is, what are the cultural barriers? Whose culture is being served? Institutions are themselves shaped by cultural norms and assumptions. So you have to be curious about what those are and whether or not they're creating barriers to connecting and reaching communities. So some of the questions you can ask is, how will people be welcomed when they get to a cooling center? What activities or foods will they find? And how will information be shared? Next, the next question is, where are communications being shared? Are you reaching communities that are vulnerable with messages that where people would see them in a manner that they would understand? And next, how are messages being communicated? And this has several aspects. So of course, you have to communicate messages in multiple languages so they're accessible to relevant community members. cultural framings for English to non-English translations, oral communications, in addition to written communications for individuals who have limited literacy or for whom oral communications are more culturally familiar than written word. Plain language that anyone can understand regardless of education. Think about nonverbal communications. For example, people in government uniforms at a cooling center might signal that the cooling center is safe for some people. But for others, for example, from mixed immigration status families, it might actually signal that the safety center is or the cooling center is unsafe because of immigration concerns. It's important also to provide information on culturally specific concerns. So if the cooling center is actually safe for people who are undocumented, then communicate that to the public. Communities of color, especially Hispanic and Latino communities, need to know that information. And of course, don't rely on children and family members to be interpreters. These are all just basic steps that go into creating cultural safety and work to undo the biases that have harmed communities of color and help create a culture of inclusion. Next slide, please. So the final example that I want to wrap up with that we talk about in the law and policy pathways is using the spectrum of community engagement to ownership tool, which can help measure local government's level of community engagement. It can really be used by anyone. This tool was created by Facilitating Power to assist people in gauging where they're at with community and how well they're doing. So as the toolkit creators explain, each step is necessary except for the first one where you ignore and just simply marginalize community. There's not an expectation that you just jump to step 5. It's a process. So what is this process? So starting with step 1, your stance towards the community might be to just inform the community of what your plans are. And the impact is to placate community. The message is, we'll keep you informed, right? So this is going back to barriers to community engagement. You kind of come with the end product to community. Moving up from that, you can consult with community, but the impact is still tokenization. You gather input from the community. The message is, we care what you think. So this might include public comment, focus groups, surveys, but community members might have no idea how that information is being used, and in fact, it might not be used at all. Moving up from that, you can involve the community. The impact is community starts having a voice. The message is, you're making us think and therefore act differently about the issue. This involves community organizing and advocacy, community forums. Next, you can collaborate with community, and the impact is now you've started to delegate power to the community. The message is your leadership and expertise are critical to how we address these issues. This includes citizen advisory committees, open planning forums with citizen polling. And then finally, step 5 is defer to community. The impact is community ownership. The message is, it's time to unlock collective power and capacity for transformative solutions. So this includes community-driven planning, participatory budgeting, cooperatives. So I think this is such a great tool because it can really help organizations seeing how and whether they're meaningfully engaging with communities, whether it's cooling centers, planting trees, developing a heat plan, whatever it is. If you're really engaged with community, your plan shouldn't look the same from the original plan, but that's a good thing because community voice can help make your plan stronger. There's a lot of wisdom because, as we all know, community members are the ones that are actually living through these climate issues. So again, feel free to put in the chat where you think your organization is on the spectrum, or where does your organization want to be. Next slide, please. And with that, I'll wrap it up. I just wanted to thank my 2 research assistants, Mashalwa and Jade. Thank you.
I guess we'll start taking questions. I didn't see any in the Hoover app, but if people in the room have questions, let us know.
Hello, thank you for allowing me to speak. My name is Maisha Johnson. I'm with Metropolitans Congregations United. I live in an underserved community in South City here in St. Louis. And so they try to shut down one of the only hospital that we have in that community, and they're not able to. We're working on like our third or fourth owner for this facility, and the need is there's high cancer, asthmatic, and mental illness in our community, and they're starting to cut the trees down. They say it's because the ash. I understand that, but they're not planting them. And we know that we have heat waves during the summer, which cause all the triggers that I just named. And housing is another issue. Often we speak of climate change and the disparities that happen in these communities, but housing is often left out. And that is one of the things that's also causing health issues as well as being affected by the climate, because the mold and the water that they drink, they're all being affected by the land that we live on. Trying to get the health department involved in certain spaces when it comes to housing and the spaces that people live in has been hard, though that we feel that's part of their job. How do we hold folks accountable that this should be a concern for that's not showing up in the spaces where community are asking them to be?
Okay, so I can go ahead and take that question. I mean, I think that's a really good question, and it's unfortunate that it's so hard to connect with the health department. All the evidence shows that, for example, in Miami and Arizona, in LA, where they've been the first in the United States to appoint heat officers, that things like planting more trees is essential, especially for formerly red line communities, underserved communities. They can be 5 or even 10 degrees hotter than surrounding areas. So there is that evidence-based and research out there that you could provide to the public health department. And I think that there's large consensus and more people are aware of the role of public health departments in protecting people from extreme heat and other climate harms. I think it also just shows why climate is just such an intersectional, cross-collaborative issue. So any way that you can work with other organizations that are more open and more willing to work on these issues and understand these issues to try to get some movement from your local health department, I think would be a really great strategy to kind of to mobilize. Like you said, there's just all these issues with housing and, when it comes to weatherization and air conditioning and, water quality. So working across sectors can sometimes be a really powerful tool to get movement on government agencies that might not necessarily be as motivated to address the issues.
The only thing I would add to that too, and April, I'd be curious what you think, but maybe reaching out as well. I don't know if you're connected with like local legal aid. Sometimes they have really good relationships in terms of housing issues, but they might. Okay, I figure you probably you knew all the organizations around, but that was just who I was thinking because I know local health departments, especially after the pandemic, they have just gotten to a point where it's like they're so overwhelmed with things to do that I feel like it's hard to push to that next level of things that aren't on the requirement list. And that's not trying to be shady to health departments. I think it's just kind of the nature of the situation right now. So yeah, I agree with April and finding some of those other orgs who can kind of help.
And I think, one strategy that I've heard a lot is, and this is even how local health departments are funding their climate work, is drawing the connection between something that they're already doing and climate. So for example, if you have someone in the health department that's, really working on asthma, drawing the connection between extreme heat and asthma rates. And I think the more that you're able to draw the connection of, okay, maybe you're not working on green infrastructure and trees, but you are working on asthma. And in fact, this is going to have an impact on asthma rates. So the more you can help connect the dots, and that might make it easier for people within those departments that maybe want to do the work, but haven't gotten the green light because those connections haven't been made.
Thank you.
My name is Darnell Johnson. I am a sustainability architect out of Chicago, Illinois. And so I have one comment, an observation, and then I have a question. First, the comment, and it was really regarding one of the slides on community engagement. And the thing that jumped out at me when I was looking at the slide and actually hearing the dialogue or the narrative around it came under consult. And then it went to underneath it, it was directly about tokenization. I think that the terminology that the connotation that's associated with that can be a little triggering when we say that we're consulting the community and then it's tokenization and we say we're gathering input from the community. So it almost gives the connotation that we're going through this to, gather information from you as a token, and that in and of itself is triggering. I think that the terminology and the vernacular that we use, we have to be careful, especially when we're dealing with disinvested, underrepresented communities that have often felt that the things that were offered to them were a token. So I think that that's the first thing that we probably want to be careful about is the terminology that we use, especially when we are presenting in an open forum such as this. The other thing is I have a question is around in gathering information. As I see that is that we are gathering information, and this is probably a sticking point for me because I've seen oftentimes we come in, we do feasibility studies, we gather information, and then the institutions or the organizations, they use that information and they go out and they secure resources that are oftentimes brought back to the communities, but the people that they're gathering the information from are the community stakeholders, but yet we're not providing any tangible resource to them for their time. So where are we at in terms of bringing people into those spaces, asking them to sit in different discussion groups and focus groups, taking time away from their families and taking time away from other things, but yet not compensating them for the time that they're given? I think that is very inequitable, and it could be viewed as extraction. So do we have an opinion on that? And are we having the conversations about when we're doing budgets, are we putting money in budgets to be able to compensate? And I'm not just speaking about gift cards or gas cards because that's marginalization as well, but looking at them as actual contributors because they're really doing consulting work. If we have people that come in and we consult with them, we're consulting with them because they have an expertise or a lens that allows us as practitioners to be able to go out and develop strategies. And so I think if we're not having conversations about how we empower those community stakeholders that are closest to the problem and also are closest to the solution, we should be having more focused discussions on how do we bring those individuals in and value their input as a consultant and not just looking at them as a volunteer.
Yeah, and I think that's a great point, and that's this tool. And you can, if you want, you can email me. I can give you the larger resource that this chart, the spectrum of community engagement came from. But the tool really is meant to help clarify for organizations where they're at. And so in step 5 is what you're talking about, right? Where there's really community there's really sharing, you're sharing budgets, you're sharing power with communities, and communities are driving the solutions. Going back to the idea of consultation, it's meant to reflect this idea of, if you consult and then people don't ever know what was the outcome of that, what happened with that. And we've just, in our work, we've heard again and again, communities will often feel over surveyed, like we're always answering these surveys. We've answered numerous surveys, but we're not really seeing any change, and they don't know what actually happens with that information. And it might be that nothing happens with the information, or it might be that something great happened with the information, but the community never knows about it. And so what's helpful about this tool is it can kind of help you as an organization to look at, how are we treating community, and how can we be better with what we're doing?
Can you share that with everyone? And also, will this be shared with others? I'm sorry.
Yes, the recording will be shared. It'll be put on the app within the next few days and will be available for 3 months following as well. So that information can be shared.
Hi, my name is Heather. I'm the sustainability coordinator at WashU School of Medicine. And I have a question going back to the first question. I don't know if it's something that we can tackle in the time that we have, but I'm wondering how someone in my position can help put people in contact with the correct people to start influencing local policy. I don't have that sway. And you might have a similar situation where our School of Medicine is separate from our hospital. And so the things that we value aren't necessarily always the things that the hospital values. And so how can we influence that relationship and advocate for more local support?
That's a good question. Do you have any thoughts on it from her part to the first question?
Yeah, I think that the main thing that I would think of is connecting with community-based organizations in the area, because the community-based organizations are going to be the organizations that are often connected with community members and understand community need, and they're easier to identify. And if you start connecting with those groups and start talking to them, I think that's a really helpful tool to kind of build that collective action.
Did you want me to answer? I'm sorry, were you done? Okay.
Yes.
So we can work together.
Hi.
At MCU, our goal is to work with At MCU, our goal is to work with congregations and community to push for policy change that will sustain communities and bring about the beloved community that we all dream about. We work with WashU. We work with some students. Actually, my intern is a philanthropist at WashU. So if you give me your information, we're looking for interns for the following year and going into 2024, but as well as partnering with others on making this change that we want to see and how to deliver to community. As Mr. Johnson said, we have to be careful of the language that we use in the communities that we go in, as well as being strategic when going into these communities. Just because there's a few blocks between the communities doesn't mean the needs are the same. So each space we go in, we like to have conversation with community to see what the need is, as well as when we working with congregations, because we don't want to assume everybody wants to work on the same thing. There are different needs for different spaces.
And I'll just add, from working in a university in this space, something that may be a little bit different for us is, we're a state-run university, and to be completely frank, we're a state-run university in a very, very red state. So doing more progressive work can be really difficult, and so we have to find
different ways sometimes to couch what we're doing so that we don't get in trouble with the governor, which is maybe I shouldn't say in a recorded space, but it is what it is. So I think building relationships with community organizations and kind of like what April was saying to the earlier question, finding a way to build on work that is already being done and connecting at that level can be really helpful too.
I guess my question was more like internal. I am comfortable with, developing those community connections, but like who would you recommend are the key stakeholders internally within the medical space to add their voice to advocating for local policy?
I think really step one on that, and something that we're working on in Nebraska, and this is tangential, but I think it's connected, is providing education in our College of Medicine about climate and how climate policies impact the communities and how that can have health impacts. Making that connection, I think, for med students especially can be really important because I don't know how much of that they get in their general medical curriculum. So even just initially providing some of that education, I think equips them more to go out into the community and help a little bit more in those ways.
That's all the time we have. I don't know if you're able to hang around for a minute. I know I see one hand here. If not, also there is the chat session. There's this chat section on the app as well, where you're able to ask questions and people can respond to them. After this session, we now have a 30-minute break, and then starting at 10:30, there will be our final workshop session just before the closing panel. Thank you all again. If we can give one more round of applause for our presenters.